recording.
Welcome to another edition of Dead Air Live. What an exciting show we have tonight. ADD and the brain. And we have here Elizabeth Eyerer, who is a health practitioner for brain integration.
Yes.
Welcome.
Thank you very much for having me.
Oh, we're so happy to have you. So what is ADD and or ADHD?
Yes. Well, ADD and ADHD are something that's affecting a lot of people right now. It's from a brain integration perspective, it basically means that the logic hemisphere isn't working as well as it should. So there we have two hemispheres, what we think of as right brain, the creative side, and a lot of ADD people that have great physical coordination and are great athletes, but really struggle in school. So the right side of the brain is working really well, and the left side of the brain, the logic side, isn't working quite as well.
Okay, you're talking about brain integration. Mm-hmm. What is brain integration?
Brain integration is a hands-on technique that reconnects neural pathways in the brain. It brings together a lot of different techniques, and it helps a lot of people with a lot of different learning problems, and especially ADD.
Okay, well, I believe that we have a video that we're going to roll in that's really going to help explain. It's called Crossinology. So are we ready to show that video?
Did you find school difficult? Do you see your children struggling to memorize, comprehend, and perform well on tests? Do you notice a gap between what you know and what you do? Children and adults with learning difficulties, such as ADD, ADHD, and dyslexia, typically have problems with organization, time management, and completing projects. It's been reported that since 2001, the use of drugs such as Ritalin for treating attention deficit disorders in children under age 5 has risen a dramatic 49%. 3 to 10% of all children have attention deficit problems, and 20% suffer from learning difficulties such as dyslexia and dyspraxia. Now, you can correct ADD, ADHD, and dyslexia permanently, forever. Unlike drugs, which work outside the brain, we treat learning difficulties by working inside the brain, rewiring it to behave normally.
Crossinology is an acupressure technique that I developed over 22 years to rewire brains so that they work at their maximum potential. So I changed the electrical functioning of the brain.
Susan McCrossin specializes in treating learning difficulties using the Crossinology brain integration technique, a non-invasive, therapeutic treatment focused on eradicating learning difficulties through renormalizing brain pathways. Crossinology's brain integration technique, also known as bit therapy, addresses concentration, memory, planning, comprehension, and visual and auditory processing. The basic correction program takes approximately 8 to 12 hours, spaced over a number of visits, and may vary based on individual needs. The first session of treatment includes an initial assessment that serves as a benchmark from which future changes can be evaluated. This assessment involves muscle testing to reveal the specific brain areas that need the most attention. Treatment then deals with the brain's deep-level switching, the pathways that handle right-left, front-back, and top-bottom processing. After switching pathways, treatment focuses on the degree of activation in the corpus callosum so that the brain's two hemispheres can be used simultaneously. The limbic system is treated early in the procedure, since it is the emotional filter through which the brain processes all information. From there, we treat the eye muscles, auditory processing, sense of balance, and the vestibular system. Finally, treatment turns to coordination and fine motor control. This procedure integrates and synchronizes all the signals in the brain. After completing the Crossinology bit treatment, the client enjoys living a life full of self-motivation and actualized potential. This translates into the ability to multitask in the classroom or any other situation in life.
One of the most rewarding things about doing this work is having a child come back to you and tell you, looking you straight in the eye, that they just got 10 out of 10 for a spelling test for the first time in their life. You have just changed their future.
You can end your dependency on medication forever. To find out if Crossonology is a good fit for you, fill out the questionnaire at crossonology.com.
So we just saw this great video on BIT, Brain Integration Technique.
Yes.
Tell us about it. How does it work? Because to me it seems almost like impossible.
Yes.
Almost like magic.
It is. I have, some of my clients do call me magical, it's true.
Isn't that wonderful?
It's really fun. Brain integration brings together a lot of different kinds of work. So it brings together kinesiology, which is muscle testing.
Muscle with the arm going up and down.
Yes, that's right. We're going to do a demo of that a little bit later.
Beautiful.
So it brings together kinesiology with the Eastern philosophy of Chinese medicine and the meridian system. So I touch different points on the meridians to get information from the brain. And then there's also this great understanding of Western brain physiology. In learning this technique, we study the brain extensively. And this fusion of sort of Eastern and Western ideas creates a really powerful technique that helps people.
Was there like research done on this? I know that Susan McCrossan has been doing this for 22 years.
Yes.
But how did she come up with this? Does the AMA back this up? I mean, how do we know that this is credible and that this really works?
Sure. Unfortunately, the AMA does not know about this yet. It's a little outside their purview.
They're going to know soon enough.
That's right. Susan and Dr. Charles Krebs started this work, like you said, 22 years ago in Australia. And they did a lot of research at that time. Susan was studying at the University of Melbourne in Australia, and she did brain scans, and she looked at people and saw them before and after. So she did both testing of sort of like academic testing or intelligence testing.
That's fantastic.
To see how their scores changed, and that showed a functional difference. But then she also did scans of the brains themselves before integration and after, and the scans showed that information changed, that where the brain was lighting up before, sort of all scattered all around, was very different from after, when the parts of the brain that were supposed to light up were doing that in a really much more organized way.
But doesn't our brain light up at different times just by certain things that we think? So is that really a true way of like looking at the brain?
That's a good question. I think brain scans can be a little nebulous for people. It's true, like, you know, you're sort of looking at pictures and seeing, okay, you're telling me that that's better, but I don't know if that feels better to me. The great thing about brain integration is that we don't rely on those scans. I get all of my information just from touching the client and doing the muscle testing. So I don't use any electrodes, I don't use any medicine. I just put my hand on their arm, and when I do the balances, I hold your head, just like this.
Beautiful.
And that sends an electromagnetic circuit. It creates an electromagnetic circuit, and the information goes around and around. And people know that it works when things that were really difficult for them before all of a sudden become really easy.
This really sounds like magic. It sounds like something that I'd like to do, just for the heck of it.
Yeah, it's brain integration is great for a really wide range of people. I see a lot of kids with ADD who come in struggling with school. They might also have a little bit of dyslexia happening, where the pictures, the images in the brain are kind of getting flipped around. They might have anxiety that often goes along with that.
Sure.
And all of those things, as the person starts to change and they feel different and they start performing differently, then they can tell you, yeah, I'm different than I was before.
So why do a lot of kids today, unless we're just noticing it more, have ADD or ADHD, and the doctors want to just give the kids drugs, which is so bad. But you have a solution to all that. So what's going on with that kids have ADD and ADHD?
Sure. The brain integration sort of theory around that is that we've always had these kind of brain issues going on. But if you think about the way that society is now, as opposed to, say, back in the 40s, 50s, and 60s, we're required to do a lot more with our brains. Back in the 1940s and 50s, if you weren't good at school, you just went into a trade. And you could have a really successful career working with your hands, working in a factory, getting a great pension. You know, and it was fine. So it wasn't as imperative then that you do well in all of your subjects, not just some of them, but all of them, that you get into a good college, that you complete college, and, you know, these days they're saying that's not even enough. You've got to get a master's degree in something. So I think that we require a lot more from people now than we did then. So we're noticing it more. As far as what we do about it, it's true, the Western perspective on this is to put people on medication. Ritalin and all of those different kinds of medication. And for a lot of people, they help. They're not entirely sure why they help, which is one of the interesting things about them. I like to take medicine that they know exactly what it's doing, and they're not as sure. They're also really not sure how that medicine impacts the brain as these children grow. And that's one of my main concerns about it.
Sure, because it's chemicals.
Right, it's chemicals, and you have a maturing brain. And so that makes me nervous. And
we don't want to make you nervous.
My preference would be that if there's something else that can be done that is just as or more effective, that would be great. Another one of those things is that brain integration, you get integrated, you open up those pathways, and then the person is functionally different and they go on into their life. With medication, you usually have to take it for the rest of your life.
Now, does this brain integration work with people that have addictions, or people that suffer from, let's say, sadness, or if somebody has an accident and they may bump their head? How far does this brain integration go? Sure.
So those are really different kinds of cases. It does work with sadness, that sort of emotional issues, PTSD, anxiety, post-traumatic stress disorder.
Oh, okay, sure, yeah.
Which we might hear most frequently about our veterans coming back.
Sure.
And suffering from a lot of PTSD. You can also get that as a civilian just from traumatic events in childhood, you know, physical or sexual abuse, that kind of stuff can all trigger PTSD, where a person is reacting with a lot of anxiety. And that's a very different thing than ADD, which usually shows up more in school. So there's that one.
There was addiction?
Addiction.
Yes.
So addictions are tricky. With addiction, if the person is committed to changing, if they have stopped whatever substance they're taking, and they're ready to, you know, open up a new chapter and move on with their lives, then yes, I would be happy to work with that person. As far as helping a person to stop their addiction, that's a very different thing.
You know, like a person who smokes, or a person who drinks, or a person like myself who loves to work. I work too much.
Oh.
I wish, you know, is there such
kind of addictions?
Yeah.
Those kind of addictions I can work with.
Oh, you can?
Hardcore addictions like to, you know, heroin, that's a very different kind
of
addiction.
Sure.
Especially since that's sort of what I thought you meant. In the case of hardcore drugs, drugs or serious alcohol abuse, there you're damaging the brain as you're going. So you need to have stopped that, because that's sort of an onslaught of brain deterioration, which would undo this work, because you're changing the brain every day with that kind of substance abuse. So if we've left that aside, and this is more of sort of lifestyle addictions and, you know, being addicted to work or those kinds of things, yes, I help with that every day.
Okay, here's one. A woman dates a man, and she's like done with him, and she wants to forget about him. I've heard many women say this, I wish I could erase that memory.
Yes.
Isn't that, I mean, okay, well, whatever. Can you help people to erase a memory? I'm really going deep here.
These are great questions. Erasing a memory, I can't do that. What I can do, this sort of brings up something that is confusion at the macro level of the brain. So the big picture of the brain can sometimes be confused in a way that's called deep level switching. And with deep level switching, there are 3 different kinds. So there's right-left switching, and a lot of people who come with ADD have right-left switching. So that kind of switching means that math problems are stored in the ability to do that is in the logic hemisphere, which if you're right-handed, that's on the left. So what we think of as a left brain task. But the problem when you're switched is that the information is coming in on the wrong side.
Oh, okay.
So I go to do a math problem, and the information actually comes in on the right side, and my brain says, oh, I can't process there. I need to go across the corpus callosum, which is the bridge that connects the 2 hemispheres.
Right.
So I have to go across here. I have to do the processing, travel back across, and go back out again. So that takes 4 times longer than if it went in on the correct side.
Wow.
And that's why for a lot of people with ADD, you have issues with, school takes a really long time. They have to read things over and over and over. If they don't retain anything when they read, that kind of stuff. What you're talking about in terms of erasing painful memories,
yes,
those come up in other kinds of switching. So there's also top-bottom switching. And that's when the brain signals are going in such a way that the thoughts go around and around and around. So people who get stuck in a thought, in a looped kind of thought, they've left a relationship, they're done with it, and they're ready to move on, and yet they just can't stop that thought. That often can be switching. So for someone who wants to let go of a memory, not erase it, but let go of it.
Sure.
If you correct that kind of switching and settle the person, then the brain isn't going to be sending that kind of signal around in the same way.
So you're basically changing the signal path, so it's you're thinking logically. So your brain isn't like getting all confused, like, oh my goodness, this has happened. It's like, oh, this has happened. I have to accept this and
Right.
move on.
Yes.
So you're calming the brain waves because we're made of electromagnetic.
Electromagnetic waves.
And so
Yeah.
the electromagnetic waves, instead of being scattered, they're more fluid?
Yes, but we're also changing where they're going. So the way the brain works is that each neuron sends electric impulses to other neurons, and that's how different parts of the brain communicate with each other.
Okay.
And a lot of times, usually in early childhood, some of those get blocked.
Oh.
So, and that could be because you fall, you bump your head.
Sure.
Or it can be for an emotional trauma, either real or perceived.
That was my other question about bumping your head. If you've bumped your head, and I have bumped my head, can the bump, does that affect anything in your brain?
Yes, it does.
It does. Oh goodness, maybe that's what's going on, everyone.
Yes. So I would say that you have these stressors in childhood, and you bump your head or you have an emotional stress, and the brain, in order to protect you, the brain closes down. And as the brain closes down that pathway, it's useful in that second. Later on, when you need to use that pathway, the brain finds, oh, that's blocked. And instead of opening that up, the brain doesn't do that. Instead, it adjusts. And it says, okay, I'm going to go take a different path. So instead of going from A to B, that pathway is blocked. I'm going to go from A to Z to Q to R to P to B.
Okay.
And it just takes longer. And that kind of thinking is why people get stuck. People start forgetting things. People have a lot of these different kinds of challenges.
Isn't it true that a lot of people have a lot of things on their mind or in their brain because they're multitasking, like single moms? They're doing it all. They're working, they're getting the kids ready to go to school, they have to drive, they're chauffeuring the kids, they have to cook the meals. They are overwhelmed. Can you help people like that too?
Yes. So a lot of that stuff, I think sometimes people feel that things are more overwhelming than maybe they are.
Okay.
And sometimes a lot of that is the switching, either right, left, top, bottom, or if you have front, back switching, then you have old memories coming around and showing up right in front of your face that should have been let go of a long time ago.
Okay, real quick.
Sure.
What kind of clients do you work with?
I see a wide range. I see little kids, I see their parents, I see senior citizens.
And what kind of issues do you work with?
I work with all kinds. I work with emotional issues, speech and balance issues, memory and learning problems. I see a lot of ADD clients and a lot of other kind of clients.
Okay, we're going to go look at a video now with Dr. Ann. You work with Dr. Ann at Whole Body Solutions.
Whole Body Solutions is a place that we offer many different modalities to help people achieve their maximum health potential. And over the years, we've found that people will reach a certain level and we feel like there's still room for improvement. So at that point, we always explore the different therapies that are available. And we had a couple of clients with ADD and ADHD that were doing very well with our nutrition and chiropractic and acupuncture services, but we felt like there was a little more room for improvement. And we came upon this technique and decided to bring it in, see how it worked. And our first couple of clients did really exceptionally well with the service, so that's why we brought it on. Well, you know, every individual is born with a certain potential that's based in their genetics. And our goal is always to maximize that genetic potential. People can come about a decrease in meeting their potential through many different stressors. You can have a physical stress like a concussion or a slip or a fall. You can have a chemical stress like a food that you're sensitive to that's aggravating your nervous system, or a chemical in the environment, or many different stressors can bring us away from the potential that we're born with. The nutrition work we do deals with chemical stress, too much of the wrong things, not enough of the right things. And particularly for learning issues and brain health, you want to make sure that nutrition's paying attention to enough of the healthy fats, for instance. There's a lot of good research on the need for the omega-3 fats for the brain, for attention, for focus, for mood, for behavior. We've also found that foods can really drive chemical reactions in the brain that can aggravate brain challenges. People aren't even aware most times of the sensitivities to various food groups. And so working with the nutrition can take that chemical stress off. Whereas the hands-on technique provided by brain integration can work on reconnecting brain fibers and reconnecting neurotransmitters and, you know, getting that whole other level of hands-on from either the physical stress or traumatic stress on different levels that the brain has incurred. My favorite story, of course, has to do with my own son, who's now 10. And as I do with many of the services that we bring to the practice, I have my family assessed. And my son Cameron was an athlete, very avid baseball player. And I had him assessed. He had a little struggle with his handwriting. And as he became integrated, we left the office one night and went to a baseball game. And he hit every ball that was coming his way. And I recalled with Elizabeth, our therapist, that she had noticed he was having trouble with his eye movement down in one quadrant and that it was uncomfortable and stressful for him. And so she had corrected that and integrated it. And I really believe that he was able to see the ball better. And you know, parents came up to me and the coach came up to me. People asked me what I had done differently because he was just hitting better. On a more, you know, significant level, kids that can then go to school and not have the same stress that they used to have getting up and getting out the door in the morning, because they actually could feel comfortable in their environments. Parents reporting that they're having an easier time with their children, and you know, that's life changing, and that's the kind of thing we've seen. I know in my field, especially with chiropractic, that you can have re-injury, as I'm sure you can have with the brain. If, with my son for instance, he then continued on sports and he played football and he got a concussion, we had to bring him back in at that point. But prior to that, you know, I'm told that the corrections are permanent, you know, unless there is another injury or another trauma of some type to the brain. So there's a common belief that if a child has symptoms that might be labeled as attention deficit or hyperactivity or inability to focus or sit long, that as they get older and as they mature, those problems might just resolve themselves. That's not what we're talking about and what we're treating with our services in our office. This is a genetically determined program in the brain, or a direct result of trauma. I know in my own son's case that we were reflecting on a potential injury he had when he was sledding. So you don't grow out of those. You know, unless you correct them, they tend to get worse, and or at least not improve. Okay, so ADHD is a neurologic condition. It is genetically determined. There is some science that substantiates a higher concentration of dopamine pumps in the brain of individuals with ADHD. And what that means is that the brain might produce healthy amounts of a neurotransmitter called dopamine, but that there are so many pumps that it gets pumped up and taken back into the brain before it has a chance to reach the next nerve and send a message. And as one of the psychiatrists that I spoke to recently explained, it's like having a really great team. The brain is excellent, but there's no coach coordinating it because that dopamine isn't able to function at its capacity. So how do the services help? Anytime we can take a level of stress off of a body, then the body is more likely to achieve its genetic potential. So if that neurological system also has some aggravation from wheat products or dairy products, or if that neurological system is suffering in addition from not enough healthy fats, or not enough of the right precursors to those neurotransmitters, you know, that's where we can come and we take one stress off. And I'm sure Elizabeth can speak to the particulars of the brain integration and how that takes another level of stress or correction off the brain. So I think it's pretty fascinating because when I decided to have my son assessed, I brought him to work with me. And he was sitting in the office waiting for Elizabeth, and I was in with patients, and I didn't have a chance to tell her my concerns or some test scores that we had seen for him or areas that I had noticed some challenge. And she did her assessment, and she came to me and she told me exactly what I knew based on other testing that we had done. And so an assessment, I think, is, you know, imperative. I also have a 16-and-a-half-year-old daughter, and we had her assessed. Now, there isn't anybody out there, I think, that hasn't had some type of trauma at some point that couldn't benefit from at least a determination of is there room for correction. And not everybody needs the same number of visits, and not everybody needs the same area of the brain corrected, but that's the beauty of having a well-trained practitioner who can assess that and then deliver the appropriate service. I think the vast majority of our clients are here because they've already noticed a challenge. Not that that is the ultimate only reason to be here. As I said, my daughter showed 0 signs of learning disability and still some areas that could improve and make life easier. So I would say if you're an active parent and you want to do everything that you can for your child, definitely bring them by and have Elizabeth do a consult and really get an assessment and see if you agree. You'll know what rings true for you and your family.
So here we are at the demonstration table with our health practitioner, Elizabeth.
Yes.
And we have Leela, a wonderful subject, and her mother, Erin.
Hi.
Welcome, everybody. So what are we going to do here?
So earlier I was telling you that I get information from the brain by muscle testing, and I am going to use Leela, who has been integrated and is doing fabulous. I'm going to demonstrate with her how I do that.
Perfect.
So a muscle test is just you hold your arm up nice and strong, and then I'll ask Leela to tell me something true. Say, my name is Leela.
My name is Leela.
And then if she tells me something that's not true, like my name is JoJo,
My name is JoJo.
all of a sudden her arm gets funny, right? Even though she's holding up exactly as strong as before. Okay, and now I'm gonna have you bend your elbows right behind your ears. This is telling the brain that I'm gonna test something about her speech. So, Leela, which hand do you write with?
This one.
Your right hand. So I'm gonna touch over here on the left, and I'm gonna have you count to 10. Yeah, let's say relax. Good, right here. Good.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
And all of a sudden the muscle goes funny. And now if you describe what a rose looks like.
It's really pretty, and it's red, and it's really soft and velvety.
Yeah?
There's a lot of different types, like down at the beach, there's like
yes. Lots, are you
different
sure?
types.
So you can see how, as she is doing something out of her creative side, out of the right side, that her arm stays strong.
So that's good.
Yes, well this is telling me where the hemispheres are located. It's not telling me anything about how they're working, it's telling me where are they.
Oh, I see.
Because some right-handed people, like my brother George, are reversed. Those are people who usually were ambidextrous as a kid.
Okay.
And so they end up having what looks like a left-handed person's brain, where their numbers are actually on the right side, and their creative side is on the left, which is what anyone who writes with their left hand, that's how their brain looks.
Okay.
They have logic over on the right.
Okay.
So
For Leela, her arm was strong when I touched her on the left.
and she was counting, and it was strong when I touched on the right, and she was telling me something creative. So that tells me that she has creative on the right and logic here on the left.
It sounds like that your brain is working just perfectly.
Yes. So that's just a really simple way of showing you just how much the brain knows.
Sure.
Leela doesn't know where those hemispheres are located, but the brain does.
Sure, and she doesn't really have to know as long as
She
everything's...
doesn't. The muscle test will show me.
Sure, okay, cool.
Great. You can sit right up.
So I noticed you were going to go, I saw in the video that you were, they were hitting the chin. What's going on there?
So this is an acupressure point. Yeah.
I see.
And we touch that at different points. When you touch like that, that's telling the brain to go into the limbic system. That's sort of the seat of all of the emotions, the emotional center of the brain where we have fight or flight, all of those kind of fear responses. At different points in integration, when I'm going in and working on different parts of the brain, I'll go in there and you'll touch those points. Those are just points on the meridian.
So Leela, tell us about brain integration. What has it meant to you coming here and getting this done? Tell us about it.
Well, at first I wasn't very sure about it, but then I found out that it actually really works because I started noticing things. I used to not be able to fall asleep very well. I used to stay up for half an hour before I fell asleep.
No way.
And now I can just lie down and just go to bed.
You're kidding. So you just go right out.
Yeah.
Very cool. Okay. So anything else that it's helped you
Well, gym, I'm just able to do everything a lot better, and school in general, I'm able to concentrate more.
Mm-hmm. So when you say you can concentrate, what does that mean exactly?
I mean, I can focus more on the subject, and I don't get distracted by so much by all the things around me.
So you're saying you're paying attention.
A lot better.
I'm really proud of you. Anything else?
That's all I can think of.
Leela, does it feel like it's just, you just do it now?
Yeah, it's natural. I really didn't notice the change. I have to think about it.
Is this something that she absolutely needed?
Well, the idea that we outgrow learning problems is it's not true.
Really?
It's
Oh,
sort
boy.
of what happens.
What do you think? You think I need some brain integration? Yeah, I thought you'd say that.
What happens instead is that we sort of arrange our lives so that we don't notice them as much. If you think about all of the things that Leela is studying right now, she is being tested on every subject, right?
Really?
Science and math and English and all of these different things. And so when she brings home her test scores, Mom knows and Leela knows what her strengths are and where her weaknesses are.
So are you saying that you went, let's say, from a B student to an A student? So something like that? Or, I mean, have you noticed a change in your... I mean, not to put you any pressure on you or anything like that.
Not exactly. Maybe just a couple, but yeah, I'm definitely noticing. I haven't checked my grades. They don't show up that often.
Okay.
Well, I'm definitely scoring higher on tests.
You are funny. They don't show up that often. Oh, goodness.
So the difference between Leela and you, JoJo, is that Leela is living a life where she's working on all of these different subjects.
Right.
And so we're seeing where her deficits are. By the time you become an adult like you have arranged your life so that you can do that segment of things that you're the best at.
Oh, I'm still learning. I'm in school.
Right, yes. And but the things that were challenging for you or for any person as a child, we eliminate those things by the time we get to college and we pick a major.
Oh, I see.
And then by the time we choose a career, we've further funneled our resources down into where our brain is working the best. So even though it feels like, oh yeah, I outgrew that ADD thing, that's in the past, really, if you were to have to go back and do all of the things that Leela has to do, you would find that those areas are still hard for you.
Sure.
And that's why you left them behind in your adulthood.
Well, I guess I definitely need brain integration. Because when I was growing up, I was always bouncing off the walls.
I can believe it.
Can you believe it?
Yes.
My nephews, they think I'm wild. I'm really not wild. I just tell them I have a lot of energy. So do you think I have ADD maybe?
I don't really know what ADD is.
Well,
ADD is really a problem with the logic hemisphere. And it means that the gestalt, the creative hemisphere, is working so well, and the logic hemisphere, the part that tells us cause and effect, the part where we think everything through to the end, that's not working as well. And so people end up with all of these troubles in school.
Oh, I think I'm okay there.
One of the things that Leela has said that she's noticed that it feels really natural, I think is a really awesome way of putting it. Because what brain integration does is that it opens up your brain so that you can use it to the very best of your ability.
Okay.
And that's what Leela's doing now. And the second that is opened up, her brain was like, oh yeah, I don't want to do things the hard way.
Is that what your brain's saying?
I want to do it the easy way.
It's like, why was I doing that? I don't need to do that anymore. I have these new ways to do it.
So do you like consciously think about that, or does that just happen?
It mainly just happens.
You're kidding. Really? Now, Elizabeth says that this is going to stick. Do you think this is going to stick?
Yes.
Excellent. Okay, beautiful.
Yeah, it sticks because the brain, it wants to do things efficiently. Just like everybody, no one wants to sit in traffic and go the really long, slow way. We all want to take the expressway and get there as quickly as we can.
So I would like you, if you want to look into the camera and tell other kids, if you're having some kind of problems, go and see Elizabeth and she'll help you with brain integration. There's the camera right over there. Go ahead.
Okay.
Go ahead, right over there.
It really does help with your problems. So I guess you really should.
Thank you, Leela.
That was great. Let me give you a hug, honey. I'm so proud of you.
I hear from a lot of people that it feels really natural after because the brain takes this work and runs with it. That's one of the really great things about it. And as a result, I see people with lots of different challenges. Short attention span, one of the things Leela mentioned. I see a lot of issues with reading comprehension, difficulty concentrating. The memory gets all confused because the messages aren't getting sent where they need to. People have a lot of trouble with spelling and math. These are all characteristics of people who have ADD. They tend to be impulsive and not have a sense of time. And because the logic hemisphere is so depleted and the ADD person can't access it, there's emotional instability because the creative side that's working that side is going strong, and all of those emotions just are running wild without logic being able to come in and change our perception of the series of events. So there's a lot of different kinds of things that brain integration can help.
Thank you so much. That was a fantastic demo.
Thank you.
I learned a lot. It just keeps getting better. This is Erin, mother of Leila, and you're also a health practitioner, which is marvelous. How did you find out about brain integration techniques? I mean, you're searching, you know your daughter needs some kind of something, and to move her ahead, and where do you go for that? I mean, where does a person find out?
Well, I was looking online for solutions to ADD and to the different problems that Leila suffers from. And one day, I was checking my email, and I got an email from Whole Body Solutions in Quincy. And it said something about new practitioner in crossinology is coming to Whole Body Solutions. And I'm thinking, what's crossinology? I don't know, it just lit up for me when I saw it. And I'm thinking, and I read a little bit about crossinology, and I thought, this sounds really good. This sounds exactly what my daughter needs. It says it helps with integrating the brain and helps them with learning issues. And I thought, well, maybe this is the thing that will help her. And also, being a health practitioner, I could kind of recognize that some of the work that Elizabeth does is things that I've already heard about, and they made sense to me, and the part about switching and unswitching, the neurological connections in the brain, I thought, well, that was exactly what she needs, because I could tell she was a little disorganized in her brain. And I'm like, this is wonderful. They have a technique for correcting it. So I went to her lecture at Whole Body Solutions, and then I signed her up for some sessions, and I've been very happy with the results.
Tell us about the very thing that you noticed that was striking right up front, and that you told me about about her writing, which was just mind-blowing.
Even before we were done with our sessions, we did a couple of sessions, and I already started seeing improvements with her handwriting and her ability to put her thoughts down on paper. Because previously, she had really struggled with writing like an essay or a book report at school, and I would, be really patient, trying to help her. It was just like she didn't want to do it. I thought, well, maybe she's being, oppositional or defiant or something. And I'm like, we have to do this. It's due tomorrow, and come on, let's just sit down. And it was like, I don't want to do it. And she, all these delays and things, and I'm like, it was a struggle, believe me. It went on for hours.
Hours?
Yeah, for getting like a simple book report done.
I can't imagine Leila giving you a struggle for hours.
It was unbelievable.
You were exhausted.
I was exhausted.
And you had to get your husband, Rob. Rob, help me.
Oh, I got him to help me too, because he's really good with Leila.
He's very patient.
He's very patient. We were all very patient, waiting and trying to help her. Well, anyway, to make a long story short, after a couple sessions with Elizabeth, she could write really easily. And I'm like, how is this happening? Like, for example, she had to write an essay on recycling a week ago, and she just got her topic. She got a little piece of paper. She wrote an outline. Took her 5 minutes sitting on the couch. Then she wrote the outline into an essay. That was like another 15 minutes. Then she corrected it, typed it up, handed it in, and I'm like, this is so great. Yeah. Thank you, Elizabeth.
Absolutely. And I think this is one of the things that a lot of parents of children who have ADD and other issues struggle with, is that it does feel like they're being oppositional or defiant. Oh. When it comes to those things, like for Leila, essay writing, that just, they don't want to do it. They delay, they avoid it. They'd rather do anything else. And I think that's sort of a misunderstanding of what's going on for that person. So as much as it was frustrating for Erin and for her husband, it was just as frustrating for Leila, who would much rather just get it done the way she does now.
Isn't that interesting that you're saying that it was frustrating for her as well?
Yes. And when I hear stories like that, I think, wow, that shows me the degree of brain stress that was happening for her when it came to that task, that she would so avoid it that it would take hours instead of just going ahead and making that happen. And as soon as you open up those pathways so that the brain can just do it and without any stress, then the person just goes ahead.
Well, you heard what Leela said. She says it just happens. She doesn't even think about it.
Yeah.
Yeah.
Yeah, she actually told me school's easy now. She's like, it's easier.
Yeah. And the wonderful thing about Leela is that she's so smart. You know, this is, and a
She's
lot of my
very
clients,
smart.
a lot of my clients are very smart. I think there's this idea that if you have ADD, that somehow you're not intelligent, or that, you know, you're at the bottom of your class because your IQ is low. And that has nothing to do with brain integration.
Can we get a close-up of Erin? I want you to look into the camera, and I want you to, I guess camera 2, look into the camera and let's get a close-up of her. I want you to talk to parents out there that are struggling, because you are a health practitioner. And just, can you zoom in on her? Just like, and I want you to tell parents, because today I was at my doctor's. I was at a skincare doctor today, and she was saying someone has a problem with ADD. I want you to talk to these parents because they need Elizabeth. Talk to them.
There is help out there. Elizabeth can help. Crossinology can help. You don't have to suffer with hours with your child trying to get them to go to tutors and help them with their grades, but you can get help where you can actually correct the problem, and then there won't be any more issues. It's something that can be corrected. I think learning disabilities have been misunderstood for many years and underdiagnosed, and if there is a problem with your child, continue to search and to get help and to call Elizabeth, because she's helped Leela tremendously. I want you to get help too, and it's really easy and it's pleasant too. Like Leela tells me, I can't wait to see Elizabeth. When are we going?
Yeah, it is. That's a really
very
nice
pleasant.
thing. It's a nice thing for families and for the client that when you get integrated, you just lie on the table, as Leela did before. You know, I muscle test on your arm, and then I sit down and I hold your head. And we talk. I have toys for the kids to play with.
You're a fun girl.
I do. And we, you know, I talk, you know, I touch different points, but it's very gentle, it's very relaxing, and it's not stressful. So
how long is the session?
It takes, sessions are different. To be integrated takes generally 10 to 14 hours, depending on the person and what challenges they're
Not all
facing.
at once.
Not all at once.
But each session is how long?
It depends. If the client is an adult, then I'll often see them for 2 hours at a time.
Oh, I see. Okay.
If for a child, I might see them for 1 hour. If the person wants to get done faster, you know, I might see them for a couple of hours, then a break, then a couple of hours. It really depends on how quickly you want to get done, how long you can stand to be on the table and still. So it's very flexible.
Very cool. Oh my goodness. Do you want to add anything else? Because you did say that it's made your family life so much easier, which is another huge factor. Parents are struggling. They're getting stressed out. Before you know it, the parents are yelling at each other. You know, the whole family's tense.
Yeah, if somebody in the family is struggling, everybody in the family is really suffering on some level.
My mother has a saying, baby cries, mama cries. Or mama cries, baby cries. Everybody cries. It's no good. So, so you have, not only have you helped Leela, but you've helped the whole family.
Yes, and I've helped the whole family indirectly, and then because of that, and because brain integration helps children as well as adults, I frequently will end up seeing multiple members of a family.
Really?
Because as the child transforms, you know, the parent or their, you know, their parents, the grandparents might say, oh, I'm having these issues, and this might be something that could help me too. The trouble with brain stress is that brain stress in one person sort of spirals into brain stress in the whole family. And a lot of that behavioral stuff is not intentional or oppositional, or, you know, they're not trying to be bad, they're just expressing the stress that's going on in their brain. And if you remove that stress from the brain, the person, the family, the dynamic, then you end up with a much more pleasant living situation for everyone.
Where does one become a brain integration practitioner like yourself, and how long does it take?
That is a great question. This technique is new out in this part of the country. Susan has been practicing for 22 years out in Australia. She moved to Boulder, Colorado about 10 years ago. And she has been teaching and working there ever since. So in order to do the training, you go out to Boulder in short spurts. So it took me a year to become certified. Yeah. And there's all kinds of backgrounds that you can have to go into this kind of work. So it's totally doable for anyone, and I would encourage anyone out there looking for a new career to go into it, to check it out, Crossonology. You can Google brain integration and find it out there.
And if people want to see you, where do they go again?
They go to Whole Body Solutions. So go out, Google brain integration technique, Google Whole Body Solutions. We're out there on the web. You can find out more information about how this work can help you, your child, your family, or also be a possible career.
And I know that you are very excited about this whole technique. You may end up being a brain integration technician, which is very exciting.
Yeah.
Okay.
I mean, I would love to learn it and to change people's lives. It's so powerful.
It is.
Thank you so much for joining us today. It was absolutely fantastic. I look forward to your progress, Erin, and I look forward to possibly myself seeing you. I just would love just to see what's going on in my brain.
Yeah. Come on out, get assessed.
How many hours to become a practitioner?
There's a week of initial training, then there's, you take two-week classes, and you do case hours. You do 60 case hours initially, and then you integrate 10 clients, which takes anywhere from 120 to many more hours after that.
Beautiful.
So it's totally doable within or in less than a year.
Excellent. This is very exciting.
Yes. There are many, many people who need the work and not enough people to do it.
Thank you so much.
Thank you very much for having me.
Bye-bye. Take care. This is great. Thank you so much, Elizabeth. Thank you, Erin.